Welcome, Professor Loh. Welcome to our talk series show, SCI-PIE. My name is Chen Xing, and I will be your host today. So, Professor Loh, as we know that you are a professor of mathematics at Carnegie Mellon University, you're also the coach of the United States International Math Olympiad team, which won 2015, 16, 18, and 19. You're also the founder of an educational website called SCI-PIE. You run a Putnam seminar in CMU. You have all those jobs, all those identities. I mean, how do you manage all those jobs? And what is the things that is driving you to do what are you doing now?
Yeah, thank you very much for asking about my strange background. It is true that I actually manage a lot of different roles at the same time. I happen to be somewhat known for being the national coach of the United States International Math Olympiad team, as well as running xp.com, which is a free website that teaches people math and science. And I also am a math professor at Carnegie Mellon University. Now I also happen to be working on NOVID to try to help rid the world of COVID-19. The question was how to manage all of these different things at the same time, and rather what makes somebody want to do all of these? The answer I'll give is, actually, I really think I only have one job. My only job that I think about every day is how can I use whatever skills that I happen to have to try to make the world a better place. And the skills that I bring are the ones that are somewhat in mathematics, science, and technology, which is actually very powerful. Because it's actually through math, science, and technology that a single person's effort can be multiplied by 1 billion times. And so I'm very interested always in trying to see what are good ways to use any of the math, science, or technology that I happen to know to try to help everyone. So when you go and pick apart these different things that I do, they're actually all under the same roof. Because when I'm trying to teach people math, whether it happens to be at Carnegie Mellon, or whether it happens to be on xp.com, or whether it happens to be through my daily YouTube live streams or our online course, Daily Challenge with Po-Shen Loh, all of these are ways of trying to find a method for helping everybody learn math in a more deep way to be able to think. So that happens to be a driving force behind all of this. Before COVID-19, it would be quite easy to just look at the actions that I do with my life and to say, it seems like they're all around trying to make people smarter, trying to make other people smarter by using technology to reach as many people as possible. And I choose to do that because I feel that if everyone in the entire world can make better decisions, then we are in a better world altogether. And also what motivates me to do it is I actually think it's fun. I mean, I often think to myself, what is my value to the world? You know, what's the purpose of me existing in some sense? And the way I actually think about it is, it's not about how much money I earn, it's not about what I have now, but the way I value my contribution is something that happens after I'm no longer here. It's actually measured, the way I view myself is measured by, after I'm not here anymore, for how many years did how many people remember or be impacted by something that I did? And that happens to be the score that I'm trying to maximize in some sense. I'm working for that. You might ask why, like, what's the point? You're dead, right? What's the point? But I just sort of philosophically think that that is something that would be useful for all people to work towards. And actually all people can work towards that because everybody has some kind of a legacy, whether on their co-workers, whether on their organization or their family. So that's what drives me to do all of this. And all of this was around education and trying to help make people be able to make better decisions and enjoy thinking. But then when COVID-19 struck, then my mission changed somewhat. The reason for that is because when I started my PhD, I was actually funded by a group called the Hertz Foundation. It's called the Fannie and John Hertz Foundation. And this group finds about 15 people every year across all of the different disciplines, science, technology, engineering, and mathematics across the whole US. And it chooses 15 people to fund for free PhDs. Now, when you get this funding, your PhD is free, yes, but you also sign a moral agreement. And that moral agreement says if there's ever a moment of national emergency, you will put your skills forward to help. And for me, when I signed that agreement, I actually found that to be a very inspiring thing. I thought it was very interesting to be signing such a document. And it's a non-committal. If I didn't want to, nobody would chase after me for that. But it was inspiring to be part of a group of scientists and mathematicians chosen for this purpose. And in the middle of March, there was actually a message that went across this community from a person very, very well respected inside the community, who explained the terrible situation that we were in with COVID-19, and even explained it in terms of the biology of the virus that people like me hadn't paid attention to, but people who are professionals in health already knew. And that basically laid out a case. And the person said, if there was a moment of national emergency, that would be now. And so that's actually how I started thinking about this, because that's another calling. It's another calling. In some sense, there's no point helping everyone in the world make better decisions if the entire world has fallen apart. And so in the middle of March, I happened to come up with an idea that I thought could actually make an incredible impact on COVID-19. And so I sort of put things aside and I ran to try to do that.
Thank you very much for letting us get to know you a little bit more and sharing with us your motivation for your career. Since you touched the subject of COVID-19, I do have some questions regarding your current project, NOVID. So tell us a little bit about NOVID and what is it?
NOVID is an app that we created to make there be no COVID. It's actually kind of fun to have a name for which you don't even have to explain what the app does. You tell anyone, would you like to have NOVID? Actually, the answer is yes. There's nobody in the world who wants to have COVID, right? But so the purpose of the app was inspired by network theory. Mathematically, that's called graph theory, but it was motivated by network theory, which happens to be my area of research. Because you see, right after we got this almost this informal call to arms to mobilize, at the time that we got the call to arms to mobilize, I didn't really have any idea of what I would do, because I thought, I'm a pure mathematician. I think about things that don't necessarily have immediate impact. But the next day, I happened to be reading a research paper that my PhD student wrote. He was looking for feedback, so I was reading his research paper on network theory. And when I got to the second paragraph of the sentence, it just hit me like a flash that COVID-19 is a network theory problem. And if we apply network theory to it, that could be a game changer in changing the course of humanity's fight on the pandemic. And that would even work with an anonymous network. Let me explain a bit more. You see, if you think about a public health response, it is not super important that the person that we are tracking has a name of John Smith and lives at 321 Old School Avenue. It doesn't matter who that person is. What matters is who they were around. I'm talking about contact tracing already. It just matters that John Smith was around Jane Doe and that they had some contact for some time. And furthermore, all of our public health protocols, all of our public health ideas are actually in some sense algorithms that should be done on networks. And so my observation was, everyone these days has mobile phones in their pockets. It could be possible to use mobile phones to automatically build an anonymous network.
When you first install our application, we don't ask for phone numbers, emails, usernames, logins, anything. We don't know anything about you, and it will stay that way. So, we'll start by telling you a little bit about how our technology works. At the moment, we're the only app that overcomes the known accuracy limitations of Bluetooth. Bluetooth could potentially pick up other devices through walls and through floors. What makes NOVID special is its use of ultrasonic, high-frequency sounds that you can't hear but your phones can. When device A sends a sound to device B, we know the speed of sound, and we know the time that device B heard the sound. So therefore, we know exactly how far away they are from each other, and if they were close enough to transmit coronavirus to each other. When we set up the device on the right, we agree to the exact same permissions, and then we are taken to our dashboard. The dashboard is the heart of NOVID. This is your control center. You'll be able to figure out how many unique daily interactions you're having, as well as any possible exposures. The whole point of this chart is to give you the information you need to see how well you are social distancing and to gauge your impact on this situation. We provide an easily accessible How It Works section in case you'd like to relearn some of the information you were presented with in the onboarding process. A few minutes since we first installed this application. My hunch is that one of these devices will show an interaction, and indeed the iPhone does. And so a short while later, the Samsung will too. This means that both of these devices have communicated anonymously, and they are aware of each other. We don't just stop there though. What if you wanted to know if you had been indirectly or distantly exposed to coronavirus through one or two people in the chain? Well, we can do that. NOVID was founded by Professor Po-Shen Loh, a network theory expert, and this is just a network problem. So we can anonymously and reliably tell you if you've been exposed to coronavirus through different degrees of people. This can help you stay vigilant, maintain social distancing guidelines, and help play your part in stopping the spread of COVID-19. With this simple technology, we hope that you can play your part in helping the world return to normalcy and stop the spread of COVID-19.
And if we did this, that would only be stage 1. Stage 2 would then be to engage all the power of network analysis, all of our understanding of biology, epidemiology, and mathematics and computer science, and to roll out interventions that could go across this network in a voluntary and anonymous way. And then the game became, can we make such an app that the average person might actually want to install because they feel safe installing it, and where it gives them value? And so here's what NOVID actually does. When you install NOVID, it doesn't ask you for any information. You don't have to tell it your name. You don't have to tell it your mobile phone number. Don't have to tell it your email address. It does not even collect your GPS coordinates because your GPS coordinates actually tell who you are. None of this. Instead, what happens as you're walking around in public, if you are near another phone which also has NOVID installed, then the two phones exchange some random IDs. In fact, when you install, you get a random ID. The random ID is generated when you install. But that random ID is invisible to everybody except us. We don't even tell you the random ID, so that if any time in the future, maybe if the government or if someone forced you to try to show your random ID to them under force, you actually can't. And this is important, because if it's impossible for the person to show their random ID, it is impossible for the person to be forced to. And instead, this ID is stored somewhere hidden in the phone. And whenever the phone is detecting other people, it just sends to us, to our server, some completely anonymous information. So that also, if a government or anyone ever told us, give everything on your server, the information we provide is not enough to figure out who everyone is. However, it's enough to find out that these people are nearby. So then that goes to the second feature of the app. On the app, there's a button where anyone can press self-report positive test. When they press the button self-report positive test, once and only once, there's a signal that's sent out through the network. The signal goes to any other mobile phone that they were close to for the amount of time that the United States Centers for Disease Control think is important to track. So for example, right now that is 15 minutes within a close proximity. And what happens is that the other person's mobile phone gets a message, and the message is anonymous. It's anonymized. It says, someone just self-reported a positive test. During the period that they were potentially contagious, they spent at least 15 minutes close to you. This kind of a message, when the other person gets, is very useful. It helps the other person make a better decision on whether to visit an aging family member, or just even what to do in public. So the idea is this kind of a notification could actually help to provide all the people in the world with the power to make better decisions on their own. This was inspired when I saw that everybody was locked down. When you're forced to not go outside, there's a reason. The reason is because COVID-19 does a lot of its spreading. Some papers even suggest almost half of it spreading before you even know that you have any symptoms at all. So there are people, actually even people who show symptoms eventually, about half of the spreading happens before they show the first symptom. And so what we seek to do is we seek to help each person get that advance warning so that they know that they might be spreading. This is the alternative to what we're doing right now, called force everyone to stay at home because nobody has a clue who's spreading. That's called losing control. All people lose the control to make a decision because they don't have the information to make that decision. We seek to give that information to help each person make that decision. And as each person makes that decision, this makes everybody safer.
Professor Loh, because you mentioned the NOVID app is a self-reported app, how can you acquire or regulate the accuracy of the data if the data is only acquired subjectively?
It's a great question that many people ask, which is how can you rely on self-reported positive test data when this is such a serious issue? I would say that the answer is almost that self-reporting is more powerful. And let me explain why. So first of all, to control against false self-reporting, we use user experience. We use a user experience design. And in particular, it's actually designed in a way so it's very hard to accidentally falsely self-report. I'll admit that sometimes when I use apps or when I go on the internet, sometimes I just click on the colorful button because I'm lazy. I don't read all the things. I just click, 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 and you go on. It is impossible to self-report just by click, click, click on this app. You actually have to type some things in. You need to choose the date and time that your symptoms started. So it's very hard to do by accident. Now let me address the other piece of what if somebody wants to do it intentionally. Well, if you do it intentionally, first of all, on NOVID, you cannot self-report unless you have installed the app for 7 days first. So this already limits the amount of annoyance that you can generate, because if you want to annoy people, you can only annoy people once every 7 days. But secondly, that's where the accuracy comes in. You may have heard that there are many apps that are trying to do similar things, but a lot of those are based on a technology called Bluetooth, just a Bluetooth radio to communicate with headphones. Bluetooth, as you know, goes through walls and ceilings. You can listen to music even in the other room. We use both Bluetooth and ultrasound so that our signals do not go into other rooms. And what this helps to do is it helps to make it so that the number of people that we detect that you were close to for 15 minutes is actually a tighter radius. So now if you really want to annoy someone, first of all, you can only do it every 7 days. And second of all, you need to first get really close to them for 15 minutes, at which point you have already annoyed them. Actually, at that point, you are doing something extremely annoying and extremely dangerous in a scary time, called getting right up next to somebody for 15 minutes and following them around. So what I'm trying to say is that there are some apps which are based on GPS only. On those, it's very dangerous that people can self-report because they just pretend that they were somewhere. They can send some data saying they were in these GPS locations and now they're positive. In our app, you cannot. In our app, you actually have to be next to the person that you're trying to annoy. And at that point, you are physically next to that person you're trying to annoy, physically in the same room. And that person is probably not appreciating this. But now I want to say why it's a power. The reason why I think it's actually very important to have these kind of things that are self-reported is because we also tell people the truth. We just tell them somebody self-reported a positive test. We don't tell them that somebody has a confirmed test. Why? Because in fact, there's a lot of potential for what you can do as you start to have different levels of self-reporting. In fact, unfortunately, in many countries in the world, the issue is that there are not enough tests. Even if you want to test, you cannot test. Right now, because we've already built this app and we have this network that we're able to collect, already people are talking to us who are the kinds of people who are making these at-home testing kits or these other ways to make tests. You see, what we can actually do is as we start working with people who make tests that are maybe not the CDC test, we can actually start to have different levels of this self-report. You can self-report a positive test, which is one of the official ones, or you could even have a verified by one of these partners, verified unofficial, if that makes sense. When I say unofficial, I mean verified at-home test made by this at-home test provider who tests 10 million people a month or something like that. But the value of that is then even if there are not enough real tests, through this ability to report other kinds of tests, we could actually provide that information we need. And the reason why it's safe for us to do that is because our app is still anonymous. So there's no negative consequence of getting one of these alerts. If you get one of these alerts, it is only for you and nobody else in the world knows. So it's just to help you be more careful. On the other hand, in other systems where, for example, if you report positive, there are governmental rules that prevent you from moving in public, at that point you need to be very careful. I understand. Don't make people inconvenienced falsely. But in our case, all that would happen is you would just start being more careful, which might not be a bad thing anyway.
Professor Loh, I do have another question. So, supposing I install your app and I have been alarmed that I was exposed to COVID-19 positive cases for at least 15 minutes someday last week. But at this point, I don't show any symptoms. So how should I react to this app? And should I also alert for the people who come in contact with me?
This is a great question that you've just asked. What happens if you find out that you might be positive? Should you start telling other people? Because indeed, maybe you're starting to infect them. Well, that's where the network theory comes in. In fact, NOVID doesn't only tell you if you have been in direct contact with people who are exposed. Actually, NOVID will also send messages like this. As soon as someone presses that button, that one and only one time a message is generated, and messages also include someone just self-reported a positive test. During the time that they were potentially contagious, they spent at least 15 minutes with someone who at least 5 days later spent at least 15 minutes with you. So you see the factor here, why 5 days? Because there's of course we changed the 5 days based on whatever the scientists are thinking at the moment. But we factor in the incubation period. So you don't actually need to immediately worry about that person, but you should already start to alert if this has been in public for a while. Something that's important is after you press that button, we send no more signals. So if you have the app installed and you're walking to the grocery store, we will not tell anyone. And you might say, well, you should, right? I mean, if you know that the person is positive, why do you let them go out? Well, the reason is because we are not an app to control people. That's not what we try to do. We are an app to help people make better decisions to control themselves. I would hope that if you know that you have COVID-19, whether you have our app or not, you act more responsibly. I think that is an important piece that we all need to do together. However, we chose not to put that piece in only because we want to make the app more user-friendly. This app works if everyone is willing to install, and to be willing to install, you need to know that there will be no negative consequences. On the other hand, if there are no negative consequences, but you become part of this signaling network, that is extraordinarily powerful, because then in each community, as the COVID-19 starts to enter the community, everyone in the community immediately knows that COVID-19 is coming into this very small group of friends, family, and co-workers. And what they will all do is they will all immediately start to wear masks, keep distance apart. And what I'm saying is through the natural human behavior, the COVID-19 will not spread like wildfire through that community. Whereas without NOVID, what would happen is that it would get into the community, nobody would know because someone would transmit for 2 days before they exhibit symptoms. Then one person exhibits symptoms, but then nobody knows who got it. And those people keep walking in the community, all transmitting 2 days before they give symptoms, and the whole community gets sick. That's what there's a difference, NOVID versus no NOVID.
So based on my understanding, you can only be tested if you have a travel history or you show a severe symptom of COVID-19. So if I do get alerted by the NOVID app, but I don't show any symptoms or I show very mild symptoms, how do those people can get tested out? What can they say to their PCP? It just seems there's not enough tests available there.
Thanks for asking about what to do, given that there sometimes aren't enough tests. It is true that in many parts of the country and maybe many parts of the world, there are not enough tests, so the tests are only being given to people who match up at a certain level of symptoms. The way that we think about this is that is the reality of the world. There are not enough tests in the entire world. And because what NOVID does is once there's a positive test, it lets you inform so many people, it actually multiplies the impact of the test. So in a world where there are more tests, it would be very reasonable for somebody who tests positive with NOVID, it would be very reasonable for someone who finds out from NOVID that there was a positive test that spent at least 15 minutes near them. It would make sense for that person to also want to get tested. As soon as we have enough tests to do that, that would be a very powerful way to completely stamp out the infection. If you imagine that people had this, and as soon as one person tests positive, immediately all the people around them start taking tests, and anyone who's sick already knows, and they just stay home, gone. I mean, then the thing doesn't just keep spreading. That's the dream. And honestly, my hope is that we will soon have more tests. Once there are more tests, if you have NOVID around, you can allocate the tests like this. You should actually randomly use some of the tests to completely randomly test people. Why? Because if they are running NOVID, any test that you make that's positive has 100 times the impact. You see, right now, if I do random testing, you ask like, why do hospitals, or why is there a limit? You must show symptoms before you test. Because unfortunately, there are not enough tests. And if you do one test and it's negative, no information. And if you do one test that's positive, you got one case. But if you can say that one test has one positive case and 100 notifications, actually this is very useful. So really my hope is that we would split the budget so that some of the tests are random, and then once there are these positive ones, the other tests go directly to the people who are potentially infected. Now, getting more tests which are officially certified is going to be hard. And that's also where I think it's very interesting that there are so many other groups trying to find other ways to make testing. And what we hope to do is we hope to be able to let you tell what kind of this informal test you gave. Because actually the network is also powerful. If inside this network I find out that near me there are so many different people who all show up positive on these informal tests, and even if I cannot get a real test myself, what I will do is I will still change my behavior. I'll be more careful. And that's actually what we're trying to do.
I want to talk about the herd immunity. It is believed that within a community, if 70% to 90% of the population are infected or positive, the community achieves herd immunity. So some article even say New York City achieved herd immunity. How do you think NOVID app can help those communities already achieve herd immunity?
A good question is whether or not this herd immunity has already been achieved. And if so, maybe we don't need anything. Well, the way I think about this is the world had not ever seen COVID-19 before. So we actually don't even know the long-term consequences of COVID-19. I think it's very dangerous to say, well, it looks like it's okay after people get it. It seems like they are fine after a month. I don't know of that many drug trials. Like if you imagine an FDA trial, if you say, all I will do is I will see what happens in the next 2 weeks. And if it seems fine, let's roll out the drug and let everyone in the whole world take the drug. No way. But that's what this is like saying. Saying that we'll just get herd immunity with a completely unknown virus is like saying I have not only an untested drug, I have a drug from a mad scientist who has no track record. That's called COVID-19. I'm not saying it was produced by anyone. What I mean is COVID-19 just appeared. And the idea of saying, let's let everyone just get it, it seems like it's fine a month later, is like saying, I just got a brand new drug, give it to everyone, seems like it's not killing too many people. It's killing some, but not too many. See what happens. No, like that's not how we run medicine. So the way I think we should do things is we should still be very careful of spreading. And so even in places where people think they have herd immunity, I think it would actually be important to even have a sense of whether it's just that we think they have herd immunity or we know that they have herd immunity. Even now, we keep seeing that people are starting to report, maybe you can't get it twice. But I've also seen reports saying that there are even different strains of COVID-19 already, like the one that emerged from different parts of the world. And at that point, if there are different strains, how do you know that the immunity to one strain makes you immune to the other strain? We don't know these things. So I will say that, yes, maybe we'll be lucky, and maybe it turns out that it is no big deal afterwards. Although actually I think that many of the reports are indicating it has very unknown consequences, especially on young people, where it does strange things to your blood as opposed to strange things to your respiratory system. So my answer is, it may be true that some groups have gotten some level of immunity, but we don't know what is the long-term outcome of this. So it's probably better safe than sorry, and it's also probably quite wise as soon as possible to start building this network, anonymous network. Because if the anonymous, let's put it this way, imagine the anonymous network was already in place in January. None of this would have happened. Right? What I'm trying to say is that it is not really smart to say, looks like it's probably good enough, let's let this go, because this will not be the last pandemic. Actually, Bill Gates has a very interesting and long article where he calls this the first modern pandemic. And he has lots of thoughts on how you approach this. And actually, it's called the first modern pandemic because it's not going to be the last. And I was motivated to go and build this NOVID because I saw that because of the technology that is available now, really now in 2020, we have the capability of being protected against the next one, or actually helping in the current one too.
Professor Loh, because you mentioned NOVID app is using the ultrasound and Bluetooth technology, is there any long-term impact of the ultrasound due to our physical body if we are using the NOVID app all the time?
It's a pretty good question that you've just asked about what is the long-term impact of ultrasound on the body? Because we often think about ultrasound as something that you get in the hospital, and it looks like a sensor. And so maybe one would wonder, is that as damaging as X-rays? Well, there's something important to say, which is that ultrasound sounds exciting to people because it sounds like some really advanced technology. Ultrasound just means sound that's at a frequency beyond what humans can normally hear. We are emitting this with the phone and recording it with the phone using the normal speaker and the normal microphone that's on every phone. And when it's called ultra, all that means is it goes beyond the frequency that normal people can hear. Actually, the way I tested it is we have a 6-year-old daughter. And so I just tried playing different frequencies on my phone. You can get an app that just plays different frequencies. Some of them sound like a piano note. Some of them sound very, very high pitched. And then at some point, it's very interesting. My 6-year-old daughter says she can hear it. And my 13-year-old says she doesn't hear anything, right? This is called how kids are able to hear higher frequencies. But then when we got to the point where my 6-year-old daughter could not hear anything, then we had just gotten just beyond the range of human hearing. What I'm trying to say is this is no more dangerous than just some normal sound playing out of your phone. And in fact, the frequency range that we use, if I want to give numbers, is from 18 kilohertz to 20 kilohertz. If I want to put things in perspective, normal people can hear a high-pitched 16 kilohertz sound. You hear this very faint, like a very high-pitched sound. But once you get to 18 kilohertz, you don't. But 16 kilohertz, 18 kilohertz, this is not like 16 kilohertz versus 18 megahertz. What I'm trying to say is that they're all within roughly the same range. And so it just so happens to be that the way that people design speakers and microphones, they're capable of sending and receiving noises that happen to be just beyond the range of our hearing. Because maybe if we're listening to a really nice music, even though the music, the main tones, the main notes of that are inside our human frequency range, maybe the other pieces add extra depth or something to the music. So that's why the speaker and microphone supports. But we actually don't go way, way, way beyond. So this is not the same as an X-ray. In fact, this is just simply speaker playing sound. And sound happens to be at a volume that wouldn't hurt your hearing anyway. Actually, we're safe about that. We choose the volume that doesn't hurt your hearing.
What is the current status of NOVID and what is the challenge?
Thanks for asking about the current status and our challenges in the NOVID app. We are very, very happy that Google has officially approved the appearance of NOVID on Google Play for download. What I mean is that this is actually not trivial. Because of the sensitivities around COVID-19, there are some very, very strong policies at Google and Apple that prevent COVID-19 apps from being released. This is a good thing. You don't actually want random people making apps that are something to do with COVID-19, which are completely bogus, completely wrong. So there are all of these constraints. Fortunately, our app is not bogus. Unfortunately, we also are related to Carnegie Mellon University. And because of that, we were able to petition. We sent lots of letters of support, supporting us to Google and to Apple for them to consider allowing the world to download NOVID. And as of Monday this week, the week of this particular interview, it finally appeared on Google for download. This thing actually ultimately had the support of the mayor of Pittsburgh, of Carnegie Mellon University, of Allegheny Health Network, which is which I believe they run Highmark. I mean, this interview happens to be in Pittsburgh, so I'm naming all of these different groups. But Highmark also runs a health insurance for many people, and so with the support of government and university and medical institution, the NOVID app was approved in Google. Actually, we also had the support of University of Southern California's Keck School of Medicine. So I'm just trying to say, in order to make something like this get to Google, we actually had to show that this was not just some random project, but had a lot of different institutions recognize that this was valid. Unfortunately, Apple has not yet approved. Apple and Google approve independently, so each of them has their own procedure, and we have sent the documents to Apple as well. To be honest, our biggest challenge right now happens to be getting approval. We are trying to find ways to convince Apple that this app would actually be very beneficial for the public to download. And that's where we're stuck. We're stuck at a policy point right now. Now, hopefully that gets cleared soon. In fact, I would hope that that gets cleared before you, the viewer, see this particular video, because it makes no sense for there to be a working app for Android that's already there and potentially able to help save thousands, if not hundreds of thousands or millions of lives, and to just have a policy decision preventing it from going out onto Apple. Hopefully that gets solved. At that point, the next major challenge is just one of awareness. You see, when we came up with this idea, the backstory is actually, when I got this idea, I didn't have the time or ability to convince people to fund it. Actually, at the very beginning, it was just an idea. And in fact, this idea I had was even before Apple and Google made announcements that they were trying to do similar things. It was before MIT made an announcement that they might do similar things. Actually, at this point, we're the only ones who have actually done those things. The other things that I've just mentioned are announcements of work in progress. But in any case, when I came up with this idea, it was hard to convince anyone that this was worth funding, because maybe people thought it wouldn't be possible or it wouldn't work. So actually the history of this is because I run a social enterprise, I run XP, and because we happen to have the daily challenge online courses that were taken by hundreds, actually thousands of people worldwide, because we had that, we actually just chose to use that earning, the earnings from that, and just donate it to create NOVID. So in fact, NOVID was entirely, the first version of NOVID was entirely funded by just donations from my own social enterprise, because I saw this as something that the world absolutely needed and that nobody was making. So now, because of that, we also had no PR budget, no public relations budget, right? If you think about how we are versus many of the other groups which were trying to do this, other groups may have seen that this has an ability for a profit that you can make at some point, or maybe the data could be used for some other purpose. I just wanted to go and solve this problem. And so right now, because we are at this stage, we've actually built an app which is pretty good. In fact, the app, if you compare it to anything else you download today, you can see for yourself that actually it's at a different level. But we had almost no resources for public relations. So what we are looking for now is just for more people to help us share this story of how NOVID happened to be. The story of how NOVID came to be is there was a social enterprise which was capable of donating its own money to go and solve this problem. And it was activated by a call to arms, an informal call to arms, through a community of scientists and mathematicians and engineers who had signed a moral commitment to come to the aid if there was a moment of national emergency. That's how we have NOVID. And actually NOVID also works. But so the challenge we have now is how to make it so that everyone knows about this, so that even when you're looking in the media, we don't just see lots of articles talking about how somebody else is promising to have something soon, this other thing might come soon. NOVID was here on April 7th. This is like before a lot of these other articles were even saying that someone else will have something soon. We had something now. And so what we are looking for is to help to share that story. And hopefully as people start to see inside the story, hopefully people will also start to come to support the idea that this group that is making this NOVID app should be allowed to continue. It should be allowed to put its app into the store. It should be allowed for people to download this free app. That's what we're trying to do.